Now we can begin to look at how to assess a patient's risk of getting new lesions. 1 year after Dr. Featherstone published the concept of the caries balance, he published the concept of the caries imbalance. This paints a picture specifically of a patient who has the disease. Notice that the fulcrum has shifted quite a bit to the right, which will make the disease hard to balance. In addition to risk factors and protective factors, here we also have disease indicators. That's what's causing the imbalance. Our caries risk assessment instrument is based on the caries imbalance model. We have 3 columns of items to tick off: disease indicators, risk factors, and protective factors. Now, this is not about the form. It's about the concept of managing a patient's disease. Once we've determined the patient's risk level, we have to treat them according to that risk level. That means their risk level determines the treatment that we plan for that patient. So let's begin by looking at the first column. These are disease indicators, which, well, indicate that the patient has the disease. Disease indicators help identify the presence of the disease. These indicators place the patient at high risk of developing new or recurrent lesions until the disease has been controlled. All of these disease indicators are lesions. Unfortunately, the best predictor that a patient will get lesions in the near future is the presence of lesions in the recent past. Now, our operative textbook considers lesions to be risk factors, but they are really indicators. Because if you see a lesion, that indicates that the patient has the disease. A lesion doesn't mean a patient is at risk of getting a lesion. The patient already has one. So any yes in this column means the patient is automatically at high risk for developing more lesions in the near future. Now, let's go through all of the disease indicators. So our first box to check reads visible cavities and/or lesions or radiographic penetration into dentin. Here is a cavitated lesion. Here's a non-cavitated lesion. Here's a radiographically evident lesion. And this lesion is a lesion on the root surface. If your patient has at least one lesion like these, you circle yes for this item, and your patient is at high risk. The next box reads active radiographic proximal lesions. Proximal or interproximal means between the teeth. Here are some proximal lesions. If your patient has at least one active radiographic proximal lesion, you circle yes for this item, and your patient is high risk. Notice that this box says active lesions. This lesion on the mesial surface of the second premolar has not grown in 5 years. I would say it's probably not active. So this is not a new lesion, and it's most likely inactive. In this case, you would not circle yes for this item because this is not a new or active lesion. The next box reads active white spots on smooth surfaces. Here are some smooth surfaces with white spot lesions. If your patient has at least one active white spot lesion, you circle this item, and this patient, you guessed it, is at high risk. Notice that this box also says active lesions. These white spot lesions are not active. Let's compare these lesions with one of the lesions from the previous slide. The lesion on the right is active because it's rough to touch and it's bright and chalky white. It also sits at the gingiva where plaque would sit. All of the lesions on the left are shiny, smooth to touch, and more translucent white. And we can tell that these are old arrested lesions because they're nowhere near the gingiva. apparently the tissue has receded, and that takes a while. So it's probably been years since these white spots were active. They have become arrested. So for these teeth, you would not circle yes for this item. The next box reads restoration for caries in the last 3 years. If your patient had any of these lesions restored in the past 3 years, you circle yes for this item, and your patient is at high risk. So a new lesion makes a patient at high risk for at least 3 years. Notice this box says for caries. Not all restorations in the past 3 years would place the patient at high risk. Only restorations for caries would place the patient at high risk. Here's a patient I treated. She lost part of her composite restoration, so I repaired it with more composite. This restoration was not placed for caries. There was no caries lesion on this tooth. In this case, you would not circle yes for this item, and this is a big problem that 3rd year and 4th year students struggle with. You have to remember that it's restorations for caries in the past 3 years that places a patient at high risk. The last box in this column reads extraction for caries in the last 3 years. This patient's maxillary canine had such a large caries lesion, the crown busted off at the gingiva. So if this carious tooth was extracted within the past 3 years, you circle yes for this item, and guess what your patient's risk would be? You got it, high risk. Again, a new lesion makes a patient high risk for developing new lesions for at least 3 years. Notice again that this box says due to caries. Only extractions of carious teeth in the past 3 years would place the patient at high risk. This second premolar did not have a caries lesion. It was extracted because it had periodontal disease and it got really, really loose. It was flapping in the breeze. In this case, you would not circle yes for this item because there was no caries involved. As a summary, if you have any circled items in the disease indicator column, your patient is at high risk of developing new lesions in the near future, and your treatment for this patient must be tailored to that high risk.